Among the 17 Sustainable Development Goals that the United Nations proposed to transform our world, quite an ambitious goal, I will fix my attention on the goal number 3, ensure healthy lives and promote well-being for all at all ages. As you know, I'll not discuss too much in this extremely complicated slide that is the basis of I'm also teacher of global health. Also in Nepal, I had the pleasure of having these lectures that can go on for many, many hours. As you see, the global health is the health, the determinants of health is something really complicated. The United Nations decided to subdivide the SDG 3, the one on well-being, in some targets, actually 9 targets, and 4 actions. The targets are these: maternal mortality, newborns, AIDS, communicable diseases, abuse and alcohol, traffic accidents, reproductive health care, health coverage, and pollution. These are the targets. On top of that, we have the 4 additional targets, activities: tobacco control, support medicine, financing, and global health. These are the topic that I will discuss with you today. As I said before, having 13 topics to deal with, I will go a little bit quickly. I beg you to pen down what you want to discuss, and we'll be back deepening the discussion on the topics you deserved to be more important. Let's start with a technical consideration. I'm trusting very much in this aphorism that was the favorite aphorism of the father of USA statisticians, William Deming, saying, "In God we trust, all other bring data." Therefore, my presentation, it will be an avalanche of data that I'll offer you just to start the discussion on sound basis. Therefore, I'll utilize also this website. It's very interesting if you don't know it yet. Is worldmapper.org, and this characteristic is to show the world. Here is the map of the world as we know, according to the surface of the different countries. But if I change the indicator of the shape, for example, speaking about global population, you see that the world changes a little bit. India increases because it has a lot of population. Canada disappears because there are very few, as well as Australia. It disappears because there are very few. I will utilize in many instances this kind of presentation because it gives you immediately a strong idea of what's going on in a specific term. Let's start therefore with the target number 1. By 2030, reduce the global maternal mortality ratio to less than 70 per 100,000 live births. What is the global mortality ratio, maternal mortality ratio? This is the definition. Mortality ratio, maternal mortality ratio, is number of women who die for pregnancy-related causes while pregnant or within 42 days of pregnancy termination per 100,000 live births. The target is to go below 70 per 100,000. How is really the situation? This is unfortunately the situation. As you see, Europe, America, Australia, Japan, they disappear. We don't have mortality, maternal mortality. Unfortunately, Africa, as usually, explodes, but also Pakistan, Bangladesh, Nepal is rather high. In another way, this is the situation how it was in 2000. In blue, the target met. In red, the target still to meet. And if I change, look at this word, if I change it to 2017, is almost exactly the same. Nothing actually changed. If we focus our attention on Asia, again, you see that the countries represented by you are still on the way to be to reach this target. From absolute data, we can see that, for example, the situation, if 70 is the target in South Sudan, I worked over there, the target is absolutely far to be reached at 1,150. On the other way around, Italy, Poland, Norway is at 2. Therefore, we are very well beyond the needs of the target. That is, I remember you, 70. Nepal is 186. It has been a huge amelioration from 2000 to 2017 is the last data published, but there is still a long way to do. We have also to think that the highest is the risk, and this highest risk happens in countries in which there is a lot of children. For example, I don't know, in UK or Sweden, the average woman has 1 or 2 children. In Niger, 7 children. The risk per pregnancy is higher in these countries. Number of births is higher in the lower income countries, and therefore the maternal mortality increases a lot exactly in these countries in which there are more children. Situation in your countries is this one. The red line is the target, 70. You can see that the one nearest to the target is Pakistan, that is, again, the double, by the way, is 140. Myanmar, Nepal, India, all of them are on the way to reach the target. Unfortunately, Afghanistan, we are still far, far away from the target. But let's be a little bit optimistic. Generally speaking, at world level, the situation was 380 per 100,000 in 990, and 20 years later, it decreased to 210, while the deliveries attended by skilled personnel increased. Therefore, we are on the good road, but still there is still a lot of things to do. You see here the reduction in sub-Saharan Africa, in Southern Asia, etc. The green line is the target, and we are still far away from this target. What could be done? Which possibilities? A project we started, for example, in Kenya is a very simple one, taking four-wheelers and going around in the villages, performing ultrasound scan just to screen the pregnancy at risk. Is a very simple, not much expensive organization, and in this way you can detect which are the pregnancy at risk and address the mother to stay nearby a hospital to deliver in safety. First, let's go on quickly at the second target is speaking about newborns and children under 5 years of age, reducing the mortality. Again, here is the mortality. Again, Africa is exploding, but also Pakistan, India, Nepal are rather big. The same for early neonatal mortality. We are still far away to reach the reduction like in other countries. The same for 1-4 years mortality, for example. If we want to see the absolute data, I took this data from the World Fact Book of the CIA. It was a surprise also for me that the best country in the world is Slovenia, with 1.7 per 1,000 children, and Italy is just a little bit before, is 2.7. These are the data at the bottom, infant mortality. If we go on the other side of the scale, we see that numbers are awfully higher. All of them, apart from Afghanistan, all of them are in Africa, unfortunately. And the difference we are speaking is of 67 times from the bottom to the top of the scale. This is absolutely intolerable as a difference that we have to deal with. Nepal is at 26.9. And speaking again about what happened in the last 50 years, the reduction has been important. Afghanistan reduced it a lot, and you can see the same for Pakistan, Myanmar, India, Bangladesh. All of them are decreasing. Italy, in comparison, is this one. 25 per thousand, 2.5% is the target. Bhutan is on the way of reaching the target. The other countries, they have still a lot to struggle for that. Why these children die? By absolutely trivial causes. As you see in this slide, for example, the most important, the most incident is pneumonia, 19%, or premature babies, but also diarrhea, a very simple diarrhea that is one of the more stupid pathologies in a child. If you don't treat properly a child with diarrhea, he can die of it. This is, for example, the incidence of children diarrhea around the world. As you see, also in Europe, in the USA, in Mexico, all over the world, children, they do have diarrhea. Is a normal pathology for a baby. But if I go to diarrhea mortality, no one dies of diarrhea in America, in Europe, in Japan. But still, unfortunately, many children die for gastroenteritis in these countries. The same applies for measles. Again, measles is extremely simple to treat with a vaccination. All over America, no one dies of measles. In Europe, in Australia, Japan, no one dies of measles because of vaccination. Africa, look at this, is Nigeria, is enormous, but also India and Pakistan, there is still a lot of things to do. The trend is not so bad. It decreased. According, these are verbatim the conclusions of the Millennium Development Goals project, the one between 2000 and 2015. It was reduced. And this reduction is going on nicely. And again, you see all these details coming from the report of the Millennium Development Goals, emphasizing that the measles vaccination is extremely helpful. And the coverage of measles vaccine increased in such a way. In 1990, there were 12 million under 5 children dying prematurely. Now we are around 5 million. Is much less than 12, but is still an enormous amount of lives lost. We have to think also to the social environment. The infant mortality is proportional, for example, to the maternal educational level, vaccination schedule, detection of symptom of illness, and so on and so forth. What could be done? Vaccination. Vaccination is one of the most important issue to follow. Look, these are the deaths preventable with vaccination. Therefore, for my colleagues, for the government of India, Pakistan, Nepal, this is the way in which it's possible to do a lot. On the other way around, to offer clean water, simply clean water. These are the deaths attributable to water, sanitation, and hygiene. And again, you see that here there are still a lot of things that can be, a lot of deaths can be prevented just only offering a well with clean water. I'm not speaking of very expensive and sophisticated hospitals. I'm speaking just only of clean water offered to all villages. Number 3, end the epidemics of AIDS, tuberculosis, malaria, and so on and so forth. This is the situation of AIDS. Luckily, at least as far as AIDS is concerned, you are not in the horrible situation that is yet today in this part of Africa. I'm working in Zambia, Malawi, and Mozambique, and here AIDS is still very, very high. It's still hitting very high. When I'm speaking to my students asking why it has been this enormous decrease in life expectancy at birth, they forgot about AIDS. They don't know anymore about AIDS. But AIDS was the cause of, for some African countries, to lose. Take Botswana. In 1990, his life expectancy was 64 years. It fell down to 49 years. Zimbabwe, 62 years. They went down to 43 years. Is an absolute disaster. About tuberculosis, again, tuberculosis has this kind of diffusion. But if we think, is interesting, this slide showing the mortality in Italian children starting at the end of 1895 to 2010. This was the decrease of incidence of mortality for tuberculosis. These two peaks, the First World War, the Second World War, and children do not die in the war. They die because of lack of proper food, of assistance, etc. Again, there is this second peak after the First World War. This was the Spanish influenza. What we are discussing now, we are dealing now with the COVID, it happened there. Drugs, the streptomycin, arrived just only here when the incidence of tuberculosis was already 1/10 of what it was 50 years before. What does it mean? It means that to cover, to tackle this kind of pathologies is the general situation, the general nutrition of the child, of the patient is important, much more than drugs themselves. Malaria, don't speak about malaria. Luckily, you don't have this kind of a problem. In Africa, it is still an enormous problem. Again, for malaria, when we are discussing about the problem happening, the chloroquine now, there is no more. All strains of Anopheles are resistant to chloroquine. No one is looking for a vaccine, and so on and so forth. This is interesting, is the widespread, worldwide spreading of chloroquine resistance. It started in 1957 in Thailand. It was they discovered a core of gold. There was a rush to dig and to find the gold in Thailandia. All the people started taking chloroquine without any control, without any schedule and so forth, and now the spreading of malaria is all over the world. Number 4, let's go quickly. 1/3 non-communicable diseases. Which are these non-communicable diseases? In developed regions, the non-communicable conditions account for the vast majority of pathologies, not yet in these regions. We are checking the loss of lives according to this indicator. Is called the daily disability adjusted life years, and these are the numbers of years that in life that are lost. These countries, Afghanistan, they lost more than 40,000 years of life in their population. Is a complicated issue. I can't go on anymore for the moment. Also, this one is very, very complicated as a slide, but it says which are these figures represent the years of age lost for non-communicable diseases, this one, for communicable diseases, infectious diseases, and by the way, all these pathologies could be annihilated by a proper therapy. We have to deal with non-communicable diseases. this group of diseases, most of them ischemic heart problem, heart problem, and so on and so forth. What could we do? Again, prevention. Prevention is better than cure, and therefore, if we are able to set up screening programs for cancer, now we can screen the cancer of the breast, bowel, cervix, prostate. A lot of cancers can be screened. Much better an early diagnosis that is amenable to a complete treatment rather than finding a pathology, a cancer, when is already very much advanced. Again, early detection of hypertension and diabetes. Last July, the Alpine Club of Italy proposed a day of screening of hypertension. We went on all the refuges in the Alps, and all the trekkers, the alpinists reaching these huts, they were controlled by hypertension. I went to a hut, and over the some 100 people I examined, I found 3 young boys, young on his 30s, 40s, suffering of hypertension, not knowing that they were hypertense patients. And therefore, this is the way by which you can prevent this kind of problems. Number 5, preventing and treating the substance abuse about alcohol. Just to say what is the impact of alcohol, this is not luckily a problem of yours. Is much better to be a Russian lady. The average life in Russia is 63 years, life expectancy at birth. 78 for female, 68 for male, with a difference of 10 years. Why Russian men, they die 10 years before than Russian women? This has nothing to do with the war in Ukraine, of course. The main problem is vodka, because the consumption of alcohol in this country is extremely high. And as you see here, this is the proportion of alcohol attributable deaths, and this is the highest situation in the world. In Islamic countries where the alcohol is prohibited, the situation is much better. Target 6. Halve the number of global deaths and injuries from road traffic accidents. I can say anything about that. If not, I went on the Grand Trunk Road from Lucknow to Delhi, and actually I still thank God to get out safely from this traffic, because you know that the traffic in these countries is a little bit, let's say, crazy. Target 7. Ensure sexual and reproductive healthcare service, family planning, and so on and so forth. This is the number of births to women 15 to 19 years. It's dangerous to have a child at 15 years of age. Is reducing, but is still very, very high. In Southern Asia, there are still 47 out of 1,000, Southeastern Asia, and this one, 43, 44 out of 1,000 are children born by extremely young mothers. Moreover, this is going in Africa, for example. When I'm speaking about family planning, the problem is that why in Africa they do have so many children? Because a child is a sort of a social insurance for the father. A father can feed 10 children, but 10 children aren't enough to feed a father. And therefore, they need to have many children to have someone taking care of them when they are old. Therefore, they know there is infant mortality. They increase the number of children. And this is a forcing of family planning. The intra-gap mortality, if 2 children are born less than 2 years, one from the other, their mortality is much, much higher than if the difference in years between the first and second child is higher than 4 years. And this is unfortunately a vicious circle. let's go on because we don't have. And when you have in Africa, these are my mothers in Africa, 15, 16 years of age. What could be done? These are children, girls I got in Khajuraho. This is the most important thing, education of girls and the social education also of the boys. They must respect the girls. This I know that is a very hot issue in some countries. Is extremely important to start from the schools about education. Again, possibly you realize that I'm not speaking up to now about drugs, about hospitals, about medical doctors. All these things can be done, must be done before the medicalization of the problem. Is the education, in this case, the most important issue. Target 8, universal health coverage. And here we are opening an enormous problem. How can I offer this kind of protection? Who pays for health services? There are the national health system, like in Europe. The HMO, Health Management Organization system in USA, is a disaster. We can discuss it about thereafter. Insurance system in some countries, or what is now starting in Africa, village savings and loans associations, just to try to help, but is an enormous problem. Also because the public expenditure as percentage of the gross domestic product of GDP is slowly increasing, but is much more increasing in low-income countries. Again, the out-of-pocket expenditure is much higher, 40% of the total, the personal expenditure versus the government expenditure. Again, number 9, substantially reduce the number of deaths and illnesses from hazardous chemicals, air, water, and soil pollution and contamination. This is a picture taken by the space over China, Yellow Sea, and Korea. Is an extremely polluted area. And this pollution is going across the world. They found in Vancouver the same pollutants created in Beijing. And therefore, this is a problem that is more and more diffusing all around the world. And actually, if someone of you has seen the movie The Day After Tomorrow, we are somewhat approaching the day after tomorrow, because you can see this year in Italy, we had, for I think the first time in 1 century, the problem of drought. We didn't have enough water. And this is quite a problem. I'm, as Professor Buju knows, I'm a very fond mountaineer. I went to the base, Everest base camp. And when I go into my mountains, I cry looking at the glaciers. The glaciers are disappearing on the Alps. The problem is, again, complicated by the trend of urbanization. This is the trend of the population up to 2050. This is the rural population, and this is the urban population that will grow terribly. And this entails a lot of problems in the cities. This is the projection of the urban development. Now, the situation more or less at this year, well, 2025, and you see that many of these countries, of these cities, are in your countries: Mumbai, Dhaka, Delhi, Kolkata, Karachi. In 2050, Mumbai is projected to have 42 million, Dhaka 36, Delhi 35, Kolkata 33, and so on and so forth. And therefore, this will entail a lot of problems of air pollution, urban pollution, and so on and so forth. What could be done? Well, don't forget the rural communities. These people goes to the cities because they don't find in their rural communities all the commodities that can be found in a city. But if I'm able to offer this kind of commodities, a little bit of them at least, some water, some health coverage, etc., in the rural communities, I will reduce a little bit this shifting of population towards the big cities. Now let's go quickly to the targets. The target 3A, strengthen the implementation of the World Organization against tobacco control. Well, I'm not sure how many among you are smokers. I just offer you this picture. These are autopsies of lungs in an adult, non-smoker, this is the lung, medium smoker, and heavy smoker is no more a lung, is a piece of coal. And therefore, here the cancer will develop for sure. And this is, if you can show this picture to people heavily smoking, well, possibly you'll induce some ideas. Target 3B, extremely long, as is dealing with the development of vaccines and TRIPS and so on and so forth. Which are the TRIPS agreement and so on. The problem is the famous problem, patents versus patients. Shall I take into account more the wishes of the industry producing, the big pharma producing drugs, or the patient needing these drugs? This is a vignette that came out in the States, the government of the States under Obama, looking for patient rights, and the pharmaceutical companies, a shark, a hyena, a vulture, patent rights in front of the court. Is an open issue. We are speaking about TRIPS, the trade-related intellectual property rights. This has been done in Doha, 1995, saying that you must pay for the patents if there is a pandemic situation, an emergency situation. You can ask for the safeguard clauses, and you can avoid to pay for the royalties to the pharmaceutical companies. This was written 1995. In 1998 was the explosion of the AIDS pandemics. In 2000, they discovered, the 98-2000 discovered the antiretroviral therapy. But the antiretroviral therapy was covered by patents and was extremely expensive. African countries, they asked to apply the safeguard clauses, not to pay the royalties, but the pharmaceutical companies, they say, no, sorry, you can't do so. But happened the 7/11. After the 7/11, if you remember, we had the problem of the anthrax, the envelopes containing anthrax diffused. This is the picture of an envelope sent to the Senator Daschle, and the employee who opened this envelope died for anthrax. Therefore, the states decided to cover all the potential targets, 50 million people, with an anthrax vaccination. But they realized that the patent for the anthrax vaccination was German, was Höchst. They say, no, this is an emergency, a pandemic emergency. We ask for the safeguard clause, we apply for the safeguard clause, and the United States started producing themselves the vaccine. African countries, they say, sorry guys, you are the first economy in the world, and when is your turn, you apply the safeguard clause. Why can't we do the same? This led to a huge discussion. In these days, there was two people, two African people, very, very strong. On one side, Kofi Annan, on the other side, Nelson Mandela. they had a meeting in South Africa in which Nelson Mandela, Kofi Annan, they met the CEOs of all Pfizer, etc., all the pharmaceutical companies, and they say, guys, either you accept the safeguard clause or we will cheat you against all the world. The pharmaceutical companies, they say, okay, we do accept now the safeguard clause, but it will be the first and the last time. If you remember, if you ask yourself why the vaccine for COVID hasn't yet been released for free, this goes back to this situation 20 years ago. The antiretroviral therapy until 2003 was costing $10,000 with this. After that, after the lawsuit in South Africa, India, Chipla company does the same thing for $180 to $150. Look at this difference. And again, the total pharmaceutical expenditure, the high percentage, 16% of the population living in high income countries, they consume the 78% of the drugs. The 17% of the population living in small, low-income countries, they consume 1%. 17%, 1%. 16%, 78% is a little bit of a difference. Target 3C, the health workforce, the health expenditure. Let me go quickly. This is the health expenditure in the most developed countries, $10,000, $5,000 per capita per year. In the lowest, we are speaking about 78, 74, nothing. Nothing. In your countries, the expenditure per capita, Bhutan is the country spending the most, the highest level, and the other more or less in this. If we check against the percentage of GDP, is Afghanistan spending the highest part of the GDP in health, while Bangladesh and India, they don't spend too much on that. But let's go about the brain drain. This is the situation of retention of health workforce. When I was in Malawi the first time in 2006, in this year, there were 13 million people of population in Malawi with 130 medical doctors. In the same year in Manchester, there were 140 medical doctors, Malawians, who ran away, who fled the country. This is the brain drain. It's something absolutely impossible to believe. In one city in UK, there are more medical doctors than in all their original country. Last but not least, the capacity of developing countries, early warning, risk reduction, and management of national. What is interesting is that this target was issued in 2015, before the COVID. But then we had the COVID, and someone said that the virus entered in the Wuhan fish market before getting out. And no one in China warned the world about this going on. Oh, sorry, this one, the tsunami early warning system. We have an early warning system for the tsunami. Why can't we prepare the same system for these kind of problems? The first case of COVID in Italy, imported, was a young lady, 20 years old. She did a skin biopsy, and into the skin biopsy, we found the virus. It was the 10th November, not the 31st of January. The COVID was going around since many months before, and no one in China warned of what was going on. That's all. Let me finish with a bit of philosophy, which is my personal approach, what I'm trying to teach to my children, to my students about this kind of a problem, is the philosophy of the 3S. When you are approaching this kind of a problem, you have to take into account a strategy. You have to have the general idea of what you are doing. Also, if your activity is a very small one, but you have to have the general idea. Synergy, you cannot do it alone. You must go on with other people together with you. Sustainability, you must be ready to sustain in the long run what you are trying to do, because otherwise it will flop in a very, very short span of time.